tell me his business when he comes back. But no, he's out on special assignment in Michigan, believe it or not, doing some of the Lord's work and some social community work. But listen, ladies and gentlemen, we have a wonderful show for you today. We have a treat for you today. I want you to just pay quite a bit of attention to this conversation we're going to have, because one thing that, we laugh and joke, we talk about a lot of things on the show, but when it comes to your health, our health, especially the health of black people, the health of the black community, when we get that sort of information, I try to be a little bit more serious, because I really want folks to get the message. Our guest is a medical doctor. Her name is Tracy Norfleet, and she is going to help me educate you on the issues of advocating for your health, especially us seniors like me and BJ. We are senior citizens, so BJ is a little bit more senior than I am. He's shaking his head saying no. Y'all can't see him, but he's saying no. BJ, aren't you a senior citizen, BJ?
Of course I'm a senior.
Okay, keep it up there.
My son is a junior. No, I'm just joking. No, but I am considered a senior citizen. I didn't realize that it started, 55, 56, somewhere around there?
Let me tell you, son. You know how you know you're a senior? Mm-hmm. AARP will let you know.
Yeah,
because you get something in the mail.
As soon as I turned, 55, I think it was. I turned 55, somewhere around there. I got an AARP card, and I'm a lot older than that now.
Because they talk about Doge and Elon Musk. I'm like, well, AARP been having access to the same information all the time, because I've never done anything with them till I turned 55, and I got something in the mail, and it says, guess what? You now senior, you eligible for the club. I'm like, oh my goodness. Dr. Norfleet, do me a favor. I could talk a little bit about your background, but I think you can do it more justice than I can. Plus, I want the audience to hear this very professional voice that it's an enchanting voice.
I am an internal medicine physician, which means I am an adult doctor. I take care of patients from 18 until they go to heaven. I also am certified in obesity medicine and lifestyle medicine. Many people ask what lifestyle medicine is. That is the prevention, reversal, and treatment of disease through lifestyle changes. I've been practicing for 18 years. I am not a St. Louisan. I am from Louisiana, but I am here. I do speaking, I coach, I do health advocacy. I do anything I can for our community to make sure that we are educated on the health issues so we can do the best to take care of ourselves.
Your alma mater, both medical and undergraduate?
Undergraduate is Xavier, XU. We're going to have our centennial this year.
Xavier.
Woo-hoo.
And I told somebody, I said Xavier. They said, no, Pruitt, Xavier.
No.
They corrected me. They said Xavier. I'm
We're
like,
Xavier.
well, ain't that what I just said? They said
Xavier.
no.
Yes, and then medical school and residency was LSU.
LSU.
But in New Orleans, not Baton Rouge.
The same difference.
Oh, okay.
LSU. So, wait a minute, you mentioned something just a minute ago, because you mentioned that dealing with diseases and other issues through lifestyle changes. Help me out. Is there a cutoff time in your life where that is no longer any good? Do you reach a point where if you have not made those changes, it's too late?
It's never too late.
Okay.
It's never too late to make changes. If you do intensive lifestyle therapy, then you can make changes within a month.
Wow.
Yeah, it just depends on how serious you are. Like, I have patients and I'll tell them some lifestyle changes, and then they'll look at me and I'll look at them, and I'm like, tell me next time. We'll talk about it next time when you're ready.
Give me an example.
So let's talk about, lifestyle medicine is all about plant-predominant diet, meaning not eating a lot of meat.
Uh-oh.
Yes. And so when I'm talking to my patients about high cholesterol, the question is, how can I lower my cholesterol without taking medications? Well, the answer is you need to decrease your animal products. So that's beef, that's pork, and chicken, We eat a lot of chicken.
Wait a minute, the beef, pork, I understand that. Wait a minute, what's wrong with the yard bird now?
It's an animal, right?
Well, that's true sometimes.
It's an animal. It is. And I don't know what the industry has done, but everybody thinks chicken is healthy.
Right.
Like, I just eat chicken. Well, you can have too much of anything. So I've had patients with high cholesterol, and I've asked them to back off on the chicken. And we've seen their bad cholesterol, which is their LDL cholesterol, drop by 30 points within a month.
Oh, wow.
Yes, so lifestyle makes a big change, but you have to be ready to make that change. And you don't have to make it all at once. Some people want to go 0 to 100. You don't have to go 0 to 100, just small changes, and it'll build over time.
Now, you know what, Doc, I'll never forget when, ladies and gentlemen, it's no secret, I don't care what people know about my health in most cases. You know, of course, I have high blood pressure, take high blood pressure medicine. And I remember one day we was talking, and they had me on a additional medicine. And I remember you saying that, no, if you're black and you take that, it's not good. So at the point I'm trying to make, doctors prescribe medication. And if you got more than one, or sometimes they say there are some medications that you would normally take to treat an ailment, but depending on your race, that medication may not be the best one for you. How true is that?
Yeah, there are some studies. I can't quote them, but there are some studies out there. When I was talking to you, I was talking about my experience, right?
Okay.
And treating and, knowing that in my population, this medication works better than that one. But blood pressure medications are indicated for many things.
Okay.
So if I prescribe a medication, which we call a beta blocker, it can be used for blood pressure. It can be used to control your heart rate. It can be used to help you with heart failure for recovery of your heart function.
Gotcha.
So it's important to not only know your medicines, but know why you're taking your medications.
Now, and how do you approach? You go in, the doctor says, "Hey, here's your problem. I'm gonna prescribe you this and that and this and that." Patients are maybe reluctant to drill down the doctor because, like, well, you know what you're doing, and no matter what you tell me, I'm not going to understand it. So I might as well just take it at face value. Is that a good thing?
That is not a good thing at all. Your doctor should be able to explain to you in layman's terms what the medication is for and why they are treating you. And that's important. So if your doctor is not explaining to you, then maybe we need to rephrase our questions until they understand and can give us some answers. Now, if your doctor refuses to speak to you, perhaps you need to find another doctor.
Got you. And how do I say this? So I'm doing my lifestyle changes, and things are going in the right direction. That doesn't mean I can walk away from all of my medicine and treatments for good. I'm assuming that I still have to stay on some sort of regimen to make sure that I don't fall backwards. Am I right? Or?
Well, it's individualized treatment.
Okay.
And so if I have you on blood pressure medications, I'm monitoring your blood pressure.
Okay.
I get that question a lot. When can I come off of my blood pressure medications? Well, one indication is that your blood pressure starts dropping too low. If it's dropping too low or you get dizzy when you're standing, that's an idea that your blood pressure is getting lower, and we need to reduce the medications. You can really lower your blood pressure by lowering your sodium intake. That's a big one.
Salt, huh?
Salt. And salt comes from foods that you eat outside of the home, period. Foods that you eat outside of the home. If you eat something outside of the home, it's going to have a lot of salt in it.
When my steak don't have no salt
Your
in it.
steak have salt in
No,
it.
I put the salt on it. My steak don't have no salt in it.
Your steak
I
has
get it
salt
from a
in
good
it.
steakhouse. They don't use
Oh,
salt.
that's even you're gonna get me in trouble over here. But seriously though, we can really change our health. And I'm no perfect person, right?
Sure.
But we can make some big changes with we can make some big changes in our health with small changes, if you will, small steps. And we don't.
Well, I read something the other day. They had a lady, I think I sent it to you, BJ. She was 77 or 75, a runner. And they said her health she had a health condition of a 25-year-old.
Mm-hmm.
I'm like, whoa, BJ, we need some of that. They need to bottle that and sell it at the Walgreens.
You know, there's some studies of some areas in the world that are called blue zones. Have you heard of blue zones?
A little bit.
Okay, so blue zones are areas where it's plant predominant. People exercise, keep their stress down, and it's just a good, healthy environment. And so people who live in blue zones live much longer, and they're much healthier, and they have less chances of those chronic diseases like Alzheimer's and diabetes and high blood pressure.
BJ shaking his head. BJ, you in the blue zone? No. Hey, ladies and gentlemen, we're going to take a break. We're going to be right back, and we're going to put BJ in the blue zone. He's moving, y'all. I'm just letting you know. Chair, talking about health and advocating for your seniors. Let's really get into seniors. Now I know you've been doing some lecturing and some talking about seniors and educating them on how to advocate for their health needs and things of that nature. Let's talk about what that looks like. What does that look like for seniors?
Yeah, so the first thing is just to know what your health conditions are and to know what medications you're taking. That sounds simple, but many patients do not know the medications they're taking, and they rely on the medical record. But the medical record can change at any time. There's so many people who have access to that record. So you need to know what you are taking. So when you go to the doctor and the medical assistant says, are you taking medicines? Don't say they didn't change. Nothing changed because you didn't review what was in there. If it's wrong, then it's going to continue to be wrong. So I do say know your conditions and know your medications. For seniors, you usually have a lot of questions, right?
Mm-hmm.
So, and you think of these things, but write them down because when you get in the office, sometimes you can forget those questions. I would advise when you get into the office and the doctor walks in, let them know you have questions. And I say that because the doctor doesn't have a lot of time, so they can figure out how to arrange the visit to not only do the things that they need to do, but also to take care of your needs.
Got it. And so you go in there with this list of questions and you're like, Doc, wait a minute. And you begin, because some people may feel that their doctor may feel that they're pestering them because they're asking, I'm going to say silly questions, but they're asking questions that are redundant or this and that. So how do we make them, empower them where they understand that, you can ask the questions and your doctor, in most cases, should be receptive to it. How do we coach them on doing that?
Yeah, so, I have a business called Weight Liberation, so I do health coaching and advocacy to teach people and empower them so that they can advocate for their doctors. And I do that because there are only 5 to 6% of black doctors.
Got it.
And there are only 3% of doctors are black females. So the chance of you having a black doctor is really low. And that's why the panels are closed, because they're at capacity. So if you don't have a black doctor, you need to understand what your needs are so that you can ask the questions that need to be asked. Now, there are ways to phrase questions so that some doctors get offended when you're asking questions, but there are ways to phrase things like, help me understand.
Mm-hmm.
Can you repeat that again? Do you mind writing that down?
Mm-hmm.
Little things like that so that you can engage them to answer the question.
And the issue of you going in there because you're feeling woozy in the head, but there's some other things that are going on with you that you didn't make an appointment about those things. So can you just go in there and say, hey, Doc, I come here because I'm woozy, but listen, Here's
Yeah.
everything that's going on with me.
Yeah, that part is pretty tricky. Really depends on your doctor.
Okay.
And that's because, unfortunately, healthcare is a business now.
Okay.
So most doctors only have 15 to 20 minutes per patient.
Oh, wow.
That's the time from the time of your appointment, while you're getting weighed, while your blood pressure is being taken. That's all of your 15 minutes.
Wow.
So by the time the doctor walks into the office, we may have, that's 8 minutes gone. I got 7 minutes to deal with what's going on.
Mm-hmm.
So some doctors get really anxious about that because you want to give the best care to your patient, right?
Right.
And it's complicated because I understand that it's hard to get into your doctor, so you want to get all your questions in.
Mm-hmm.
But I do say focus on the main concern first.
Got
Focus on the main concern first. Again, you can say, I have some other questions if we have time to ask them, you know, just say it in a nice way, but focus on the dizziness. And then you can bring up those other things. They may actually be a cause of the dizziness. There may be some correlation so that the doctor can kind of put the pieces together of what could be causing the dizziness.
Well, I mean, Courtney says that is Ask the Doctor. This segment is Ask the Doctor. Now, he said I should have said that early on, folks, but y'all know I don't do things in the right order. Well, if I do them, that is the right order, even though it's the wrong order. Ask your doctor. Oh, okay. Now, see, he's correcting me even more, ladies and gentlemen. See, they won't let me rest. Listen, ask your doctor your questions. I'm going to ask my doctor, Michael. How about that? Is that okay? No, but serious. How is healthcare for Black people right now? How is it? We hear things on the news, we read things in the paper, and we hear people talk about, Blacks don't have the same quality of healthcare that white people have, and you just said that, with that percentage of 3%, only 3% of all of the doctors are Black females.
Yes.
And all of them ain't in St. Louis, so that's nationwide.
Right.
Wow. So what is going on with Blacks in healthcare?
Well, people have internal biases, right?
Okay.
And sometimes, the doctor may not be aware of what those things are. For instance, we've heard in the past that, and we know that sometimes Black patients' pain isn't treated, right? Because there's this myth out there that we can tolerate more pain for some reason, and so there are biases out there. You have to remember, like when I went to med school, some of my classmates, I was the first interaction with a Black person. So they are looking at the media, what we see in the media, right? And so they're getting all their opinions on media, music, and videos.
Right.
So they're coming in with a misconception of who we are, right? And so they have those internal things. But I just say speak up for yourself, right? You know when a doctor is right for you and you know when a doctor is not right for you. But do not stay with a doctor if they are not right for you. I know that's easy to say because of the access and stuff. But don't stay with a doctor if they're not right for you, because at the end of the day, it's your health. It's your care. So you have to advocate for yourself. You just have to.
And because of Obamacare, the Affordable Care Act, and people are tied to it, and Medicaid and Medicare, the restrictions on your ability to switch out doctors, you have to wait for that, for your year to be, is it a year or whatever that period of, you have to wait for it to come, but that gives you a lot of time to research
Yes, it
and
does.
look for other doctors.
It does.
And so, but they should not be afraid to change doctors.
You should not be afraid to change doctors, just like you shouldn't be afraid to change therapists. You change a hairdresser when your hair not done. You change a nail person when your nail's not done. So change your doctor.
And you change DJs when the BJ ain't. Oh, I'm sorry, BJ. You didn't hear that, did you? Ladies and gentlemen, that was somebody else talking. They hacked into the show. BJ, that wasn't me, by the way. But if healthcare is so important to the Black community, especially to the seniors, as advocates, and what I mean by as advocates, us, the people in the community, people in leadership like myself, even BJ does his community shows. What do we need to be doing to make sure that we're advocating for the right things to ensure that the Black community is at least being educated on health care?
Yeah, I would say opportunities like this to talk to a doctor outside of the office, right?
Gotcha.
So you can see that, when I'm in the office, I'm a doctor.
Gotcha.
Right now, I'm Tracy / doctor, so you're going to get a little bit of both.
Right.
But in the community, if you have doctors there, they can get their questions answered of those things that they have, or, you have a doctor speak about a topic. And so you can come back and say, oh, well, I didn't know that, doctor. My doctor told me this medicine can cause a cough. I've been having a cough. Could it possibly be this medicine? Now, notice how I said that? Could it possibly be? Don't that sound nice?
Yes.
You don't go in there and say, my doctor out there, the doctor out there said, you giving me the wrong medicine and it's been causing a cough and I've been telling you about a cough and all the things.
Right.
Yeah, that's not good. Because it has to be a relationship, a good relationship. Got
it. And Black women's health. Let's go there now.
Yeah. What do you mean about Black women's health?
Well, because I've read and hear a lot of things about Black women, especially when it comes to being pregnant.
Mm-hmm. Yes.
That they're not getting the right care,
Correct.
or even if they're in the emergency room and things of that nature, that
yes.
they not.
Yes.
For some reason, because they're Black and a woman, they look at them a little bit differently.
Yeah.
From a physiology standpoint.
Yeah, because they think we don't experience pain, or we're malingering, which means that you're pretending that you have pain. Nobody goes to the ER to pretend they have pain. You've been waiting for 12 hours.
Yeah,
right?
That, yeah.
By the time you get to the back, I have pain, sir. Right. And you're going to address it, but it happens. It's very frustrating. I did have a patient who had a lot of pain, and her pain wasn't addressed, and I had to take care of her, and that was very frustrating to me because when I walked into the room, I saw how much pain she was in. And I'm like, did they let you go home like this,
Right.
And so you got to push. I know it's a hard thing to do, but you got to push. No, I'm not leaving until my pain is better controlled. No, I'm not leaving until somebody further investigates this.
And prenatal care?
Yeah, now you out of my box now, my wheelhouse. Okay. I'm internal medicine.
Okay.
So prenatal care, how about this? Follow the advice of your obstetrician gynecologist.
I heard that. I heard that.
But, prenatal care, just think about it. Prenatal care is taking care of yourself before you get pregnant. You don't want to try to get healthy when you're pregnant. So prenatal care is taking care of making sure your blood pressure is controlled, making sure your blood sugars are controlled, right. Trying to make sure that your weight is down because you're going to gain some weight during pregnancy.
You said that word.
What?
That dirty word, weight.
Yeah.
Boy, oh my goodness.
Yeah.
BJ, we eating Ozempic and taking lemon balm and
my God.
lemon balm tea and I mean we getting all our weight loss stuff off of TikTok and everything else.
Oh my God.
I know you know something about weight. Well, BJ, you holding it. BJ, yeah. Why are you laughing, BJ?
I'm just laughing because it's so true, man. People I'm sorry, it's just people be on these diets, right? And they get on these diets like the gym. They start them like in January.
Yep.
And by the time you get to the end of January, they're like done.
Right.
Yeah.
And obesity is a serious problem in our community.
Yes, obesity is a very serious problem. About 40% of Americans have obesity at this time, and it's projected to be 50% in, I think, 10 or 20 years. Don't exactly quote me on that. But the idea is that, majority of us are overweight or have obesity. And the problem is we compare ourselves to each other.
Oh, okay.
That's a problem. So one thing I tell my patients, I'm like, go back and look at Soul Train. Look at them and look at us. There's a big difference. Or think about it. We used to call the fat boys fat,
Yeah.
which is not a good word, but we called them the fat boys. They look like normal boys now.
Ah, got
Right?
you. Got you.
And so our food is killing us. I hate to say it, but that's what I say. Our food literally is killing us because it has toxins in it. It doesn't have the nutrients that we need. Like,
But okay, we know we overweight.
yeah.
What do we do?
Well,
Now, and wait a minute, I'm sorry. I'm not overweight. I'm just a little plump. BJ, why you laugh? Ladies and gentlemen, BJ in here laughing at me, and I'm going to have a problem with that.
yeah.
BJ, I'm a little plump and only in certain spots.
In certain spots. What? Wait a minute now.
You never heard of PS plump spots?
No, I ain't heard of that. That's not a medical term.
That's not a medical term. So we overweight. What do we do? I mean, I'm just. There are some people. Let me tell you.
Yeah.
There are people seriously want to deal with
Yeah.
the weight issue, and I think they everybody's looking for shortcuts and
Yeah.
all sort of stuff. But what do you really, as an individual, and when I say that, especially as a middle or lower income individual, because eating right is expensive. I
Totally.
I mean,
It is.
it's expensive. So what do we
Yes.
do? What do you?
Well, you have to do the best you can with what you have. Like you said, we have social determinants of health. We have food deserts where there's no healthy place to get food. So some of us are placed in an environment that makes it very hard to have access to the foods to keep us healthy. And like you said, the food is perishable. You buy bananas, they brown in 3 days. You're like, come on, man, why my
Right.
bananas brown?
Yeah, buddy.
So, and it's more expensive to get those foods. So who has time to go to the grocery store 3 times a week? Not many people. And then if you have a lot of mouths to feed, that's very expensive. So not saying that it's easy, but steps can be taken. And what I mean by that is, some people be like, what I need to lose weight. Now, you need to eat fruits and vegetables, right?
Right.
When you pick up them Oreos, that's probably not a good thing. And it's not just Oreos. But the thing we are realizing in medicine and why we're seeing this revolution, if you will, happening is because, when I trained in medicine, obesity was not considered a disease. It was considered a moral failure. You need to exercise more. You're eating too much. And we're finding through science that it is not just that simple. So we call it a chronic, relapsing, progressive disease that increases your risk for all the other things, for diabetes, for high cholesterol, for heart disease. That's why we see that these medications are now being indicated for that, because we see that when we reduce the weight, we also reduce our chance of having diabetes or high blood pressure. But let's get back to being overweight, obesity, and all the good things. Okay, so first of all, y'all gonna laugh at me. Some people say, well, how much weight I need to lose? I said, look in the mirror. I'm just saying, look in the mirror and see if you like the way you
Ladies and
look.
gentlemen, BJ is laughing. BJ, don't look at me and laugh. Look over there at Courtney and them and laugh.
No.
Yeah.
No, when she said that, I look in the mirror and go, I don't like that right there.
That's what I'm saying.
How can I get rid of that?
Oh, so
right
you
there.
got some PS, some plump spots.
You know what I'm saying? Right there, yeah. Right, them little plump
Yeah.
spots. I mean, like, how can I get rid of those right there?
Yeah.
And but how do you get rid of stuff like that?
Yeah. So, when I treat a patient who's overweight or with obesity, I'm not just looking at pounds or numbers, right?
Okay.
Because when you have the BMI, which is your body mass index, it's just a calculation.
Okay.
It's just a calculation. It was not designed to be used to look at a personal individual's health. It was designed to be look at populations and studies,
Okay.
right, to be used that way. But it slowly has been applied to us. What I'm saying is that the BMI does not tell us your body composition. You can have a very muscular man who steps on the scale and his pounds are up and his BMI is So a normal BMI is 25 or less, and his BMI is 30, and you looking at him, he has no fat. So you can't just rely on the numbers. So what we do as physicians is we look for the complications of obesity, what we call the comorbidities, which are, is your blood sugar rising? Do you have prediabetes? Is your cholesterol rising? So we look for complications of obesity. Do you have sleep apnea? Do your knees hurt? Do you have arthritis? Do you have back pain? Do you have heartburn? All of those things are related to weight and lifestyle.
Remember, I got all that. What if you got all of it at once?
But that's why, and just to get back to the question of how do we do it? I don't have the best answers, but again, it has to be individualized. You know what you can afford. You know the foods that you like. Right? Because you want to make something that's sustainable and that you can just keep doing it. You don't have to think about it as much. You get used to eating it.
Now, should they be cheating? When I'm saying cheating, is this liposuction and they freeze the fat cells and they come out? They got all these things that you can. BJ, I don't know if you noticed that, lady. They got all these things that you can do that says they take like son of Bono, whoever they say they reshape your body with one visit, suck everything out.
I'm not opposed to looking and feeling the way that you want to look and feel so that you can be your best person. So I don't say any of those things are bad per se. But again, that's focusing just on appearance. So not just to look in a mirror, but what do your labs say? What does your blood pressure say? What is your waist size? You know your waist size correlates more with heart disease than your pounds.
Male and female?
Male and female.
Male and female.
So females, if your waist size is greater than 35 inches, you are at increased risk. Males, if your waist is greater than 40 inches, you are at increased risk. And we know that reducing the fat around the tummy really decreases your risk of heart disease.
Well, you just killed everybody in here. BJ, ladies and gentlemen, I'm in a room with dead men walking. I mean, because all of them got, you said 40, right? Waist size?
40
Oh,
inches.
yeah, we got some, we owe 40 up in here.
Yeah.
So, how do I say this? You said a diet high in vegetables, plant-based, is good for you. Well, we was raised on collard greens,
Correct.
candy yams, okra, all of that, and then some folks will say, well, that's bad for you too.
Yeah. No, I get that, but hey, culture is culture. We eat the foods that we like to eat, but do you have to eat a whole plate of it? Absolutely not. Right? There's portion sizes. I'm just saying, when you go to Thanksgiving, your plate don't have to be full. You can get a taste of everything.
Well, but don't you want the people that made it to think that you like their food? Ain't that right, BJ? Well, you eat a lot of it because you're trying to compliment them on their...
Well, you compliment your waist too. That's what's happening.
But I guess, say for instance, if it's the greens...
Yeah.
It's what you put in there as the problem, not the greens themselves.
But you know what? At the same time, I say let's start simple, right? I'd rather you eat greens than fast food, period.
Got it.
Right? So let's start cooking within the home. Most of the salt that we intake that actually affects our blood pressure is not from us cooking at home. It's from eating outside the home. So the fast food, going to the restaurant, kicking it with your girl. We celebrate for everything with food. I'm happy food. I'm sad food. Let's celebrate food. Let's go on vacation food. It's a birthday food.
Well,
I'm just saying.
I'm
going
to get in trouble.
What you going to get in trouble for?
Those dang millennials, they can't cook nowhere. They have to eat out.
Yeah, but it's just like we're raising a generation that it's not good. We're not headed in the right direction.
But so we need to, BJ. I gotta ask BJ a question because on October the 4th we having Sister Strutter be back, and it's breast cancer awareness.
Yes.
BJ, during that period, do we talk about what people eat and stuff? Or we?
Yeah, we do. But we got to go to a break, and so I guess we'll be right back on Point Black. How about that?
Hey, BJ transitioned us. Back in the studio with Dr. Tracy Norfleet. BJ the DJ is in here. Vidal is in here. Got the videography going. The executive producer Courtney is in here. I don't know what he's doing, but he's in here. But listen, he brought up a very good point about the fact that as a doctor, you also have this MBA. Mm-hmm. And what was it, Courtney? The weight liberation. Mm-hmm. Let's talk about it.
Yeah, so weight liberation is my health coaching and advocacy. So the reason why I started weight liberation was because I know I can't see every patient that wants to see me in St. Louis. Mm-hmm. So how can I get you the information so that when you see your doctor, you are making sure you're getting the care that you need. You're getting your screenings done. You know how to ask the right questions. Because if you talk to me, I can give you enough so that if you have a mediocre doctor, you still get the best care that you can get because you can advocate for yourself. Yeah, so that's why I started Weight Liberation, really, because it was just a frustration of my panel being closed. Most doctors, most people don't understand this, but most doctors have at least 2,500 patients.
Wow.
Yeah, and so we know the healthcare system is broken. We do. We know that you don't have access to us. We want you to, but we can't figure out how do we do that? Do I leave my schedule open and not do any return visits?
Gotcha.
Right? So how do I do that? But weight liberation is about health advocacy. I just want people to understand their health so that they can advocate for themselves.
And how do you access weight?
Yeah, so I have a website, www.myweightliberation.com. I'm also on Instagram, Dr. Tracy MD. You can find me on LinkedIn, Dr. Tracy MD. Hey. Or you might be able to see my TED Talk, which will be coming soon. So I just did a TED Talk on weight bias. You know what weight bias is? Mm-hmm. That's why I did it.
Because I wouldn't. There's BJ. Do I have any bias against my weight, BJ? Don't I look like Arnold Schwarzenegger, but in a suit?
Bro, that's all I'm gonna say to that. You know how that little thing go, bro.
BJ's jealous, ladies and gentlemen.
Yeah.
Oh no, see, I'm not jealous because I already know for a fact I look better than you. So I ain't worried about it.
Oh my goodness!
You can't match
Oh
this.
my
You know what I
goodness!
mean?
Oh my goodness!
I'm just saying. Like,
BJ, keep it up. I'm gonna take my shirt off.
okay, you go right ahead, and then everybody gonna leave. And if you notice, she said, she didn't say, she didn't go,
BJ, BJ,
she didn't go,
BJ, you're interrupting the show.
Okay, all right. Back to our regularly scheduled programming.
Yeah.
But seriously, how do I say this? People, when you call this weight liberation, and people going to access it,
yeah.
What would they find? What would they hear when they get there on the website?
Yeah. So they go to the website, they can see the services offered, and then we can schedule an appointment for a consultation so that I can discuss your concerns and I can listen to you and see if we are right for each other. I do not prescribe medication, so some people will come to me like, do you prescribe medication? No, because that would be practicing medicine outside of my job, so I can't do that. However, I can teach you about all of the medications. I can tell you the risk and benefits of those medications. I can help you figure out if your insurance covers those medications. Yeah.
So should people be experimenting with all of this stuff they see on TV and on the internet and stuff that promises this great weight loss?
Yeah. Well, you need to talk to your doctor, and that's the problem with weight bias. So it's the negative attitudes and beliefs that we have of others because of their weight.
Okay.
And so a lot of weight bias is in healthcare. unfortunately.
Okay.
And so it's hard to talk to your doctor to get them to advocate for you. And doctors, people don't, when you go to your doctor and you ask them, how do I'm going to lose weight? They're going to tell you eat less and move more. That's it. That's what they're going to tell you. But the reason why is because we were not taught. We were not taught. Like, we didn't have a lot of nutrition classes. We were taught about pathology and disease and treatment with medications. So when you're asking those things, you might not get the answer because, quite frankly, they may not know. And again, obesity was not a disease when I was in medical school, which is why I had to go back. I decided to go back and get my training because I've battled with my weight all of my life. I've done all the things. We laughing about them, but look, I can tell you about a cabbage diet, Weight Watchers, Nutrisystem, South Beach. Come on now. I didn't do Atkins though. But anyway, I could tell you about all of those things so I understand like the difficulty.
And now, I've heard this a lot, and so I don't know how prevalent it is, but when we talk about women, especially black women,
Yeah.
and the ups and downs about the weight and trying, I heard people talk a lot about stress.
Oh yes, stress is a big thing. So in lifestyle medicine, we focus on 6 pillars: nutrition, physical activity, stress management, avoidance of risky substances, and positive psychology. And so all of those things, and sleep, getting adequate sleep. So all of those things play a part in you losing weight. When you're stressed, your stress hormones are high. Your body doesn't want to release fat. It's trying to store fat. Back in the day when you were stressed, you're trying to store so you can have enough energy to do things. So stress is awful. The first thing that we can work on when we're talking about weight, before we just get to food, is sleep.
Okay.
Sleep is very important as far as losing weight and maintaining weight. But again, like I said, it's small changes. You cannot change everything in 1 year when you've developed it over 40.
Got you.
Yeah.
Got you. Yeah, because I heard people talk about the stress, and of course, they said people who smoke, they smoke.
Yeah.
To suppress their appetite, and they wind up losing weight.
Yes.
But the smoking is worse than the weight, I guess. I mean, that's where they say that.
Yeah, they have complications. We've learned that there are hormones that affect your brain, that affect your small intestine, that affect your stomach, and really can assist you in appetite regulation and also how you process your foods. And that's where the science comes in. And now that we have medications that are more efficacious, now there's being an investment into really studying what obesity is.
Okay.
So back in the day when we had medications for obesity, in order for that medication to be approved by the FDA, it only had to approve that you lost 5% of your weight. If it can prove that you lost 5%, then that medication was approved. Some of them can do 10, but when we jump into these GLP-1 agonists, which are Wegovy and Zepbound, okay? Those are the ones that are indicated for obesity treatment. But when we treat with those, we're seeing 18 plus weight loss, 22%, 25%. So it's like a revolution. But the reason is because they affect those hormones so that you're not thinking about food all of the time. You're not hungry after you exercise. So you're not battling the battle. But those medications were studied on people who were already exercising at least 150 minutes a week. They were already had a reduced calorie diet of 500 calories, and they did that for a while and then started the medication, because the idea is if you lose weight, you still need to have the healthy lifestyle changes to maintain it and keep it off.
Right, got you. We're going to be coming close to the end, so I want to really get this in. You said 3% of the doctors are black females. And 5% overall are African Americans, right? So
over 5%.
A little bit more 5%. We need more black doctors.
We do.
How do we get there?
That's a hard one. I try to, any any person who is interested in medicine, I'll have them come shadow me, right? Because you have to see, we need to expose people first.
Okay.
Because I didn't have any exposure when I was younger. I did not want to be a doctor. I found out that I could become a doctor and decided to try. But exposure would be first. So what that looks like, maybe going into schools and having a career day and letting the Black doctor come in there and have a conversation so they can see people like them to say, oh, maybe I can be that person too.
My apologies. I just wanted to say that there are efforts underway to ensure that we have more African American doctors. One of those that I know about is Black Men in White Coats. That's a traveling program that was supposed to be here in St. Louis recently, but unfortunately it wasn't able to continue. But I think we will have the opportunity to hear from Dr. Dale and that program in the future. But that's at least one way that other individuals are working to make sure that we have more Black doctors.
Yeah.
You know, once we had a young intern in the office. I never forget, I was asking her what she wanted to do career-wise. She said, I'm going to be a nurse. I want to be a nurse. I said, well, why did you decide to want to be a nurse? She said when she was about, BJ, she said she was about 7 years old, and she was over the house with her grandmother. Grandmother passed out. And she was there, and she called 911, but she didn't know what to do. And she wanted to make sure she saved her grandma. She loved her grandma and wanted to make sure she saved her. Grandmother did recover, but she said she made up her mind right then and there that she was going to be a nurse so that if it happens again, she would be ready to provide aid to her grandmother and then anybody else in her family. So it's stories like that I think that are unique. Well, listen, we're going to wrap up. Doc, any outgoing advice you want the public to know?
Yeah, I just really want us to self-reflect on how we can do better to take care of ourselves. Just make sure that you know what medications you're taking, know what your blood pressure is, and try to eat healthier. We know what healthier is. I don't have to specify it for you, but I just want us to really, really start focusing on our health because we can eliminate these diseases and we do not have to take medications the rest of our life. But if we don't change our lifestyles, we will.
Ladies and gentlemen, you heard it from the doctor. Ask your doctor and change your lifestyle. We see you next week on Point Black.